Hi, welcome to lecture 2. Why health economics matters. To understand why economic thinking is essential in healthcare. The reality of scarcity, there is unlimited healthcare needs, limited resources in terms of money, time, personnel. Every decision involves trade-off. There's a famous book by Victor, which we shall carry on later. Who shall live? In essence, in US, 70% of the GDP is spent on healthcare. What this means is that healthcare actually hires probably about 15% of the manpower in US. This means that 15% of the population in US works either in a production, financing, or regulating of healthcare. So all this means that lots of resources are actually in healthcare already. In the book Who Shall Live and Who Shall Pay, this is a famous quote by Victor R. Fruchach. The core concept is on moral values and economic realities. For example, in United States of America, the focus is on individual needs, individual priority, whereas in certain Asian countries, the focus is on the community and the greater good. This can be seen, for example, in during COVID, where you can see that countries that focus on economic development tends to open up first, whereas countries that focus on human lives and protecting the elderly who may or may not be vaccinated, even if you are vaccinated, it does not mean that you are totally safe from the COVID virus. Society must choose how much to spend on healthcare and who gets what care. This is very important. We all want plastic surgery. Some of us may want dental treatment, but not all countries cover this. Economic cannot answer who shall live because this is a moral value, moral judgment, but it can help us think about trade-offs. What is important? Do you want to spend all your money in defense? Or should some of the money in defense be spent on healthcare? This is not a decision for me to say, but a decision for voters to decide. Some of the tension highlighted by Fudge. Equity versus efficiency. For example, during COVID, the most efficient way to have vaccine is to ask the people to come to a central location for vaccination. This is the most technically efficient manner. Sorry, the most allocative efficient manner. However, is it fair? What about those who cannot travel to the vaccination center? Those who are sick, those who are handicapped, or those who don't have a caregiver to bring them to the vaccine center. This is why when you consider equity, we may want to have a home immunization team to bring the doctors and nurses to the patient at home so that they are not deprived of the vaccine. Of course, this is very expensive, but at the end of the day, do we want to be doing the right thing or doing the things right? Individual needs versus social priorities, I covered this. In certain society, the focus is on individual needs. They believe that you should plan for your retirement and healthcare needs. Some countries believe in social priority. We should, healthcare is not just a private good, it's a public good. We should all contribute. Otherwise, for example, people who are very sick, they will not be allowed insurance. I know of people who has a chronic disease and they are no longer eligible for insurance. Then who shall pay? It's not the fault of the person. What about those who are born disadvantaged? Okay, should the society play a part in the healthcare needs of these unfortunate residents? Personal responsibility, as I mentioned, how do you take care of your healthcare needs? Or should we tax you and provide? So in Singapore, we have a MediSave system where individuals will contribute to the MediSave account if they are working. But what if they are not working? There's an issue. Or what if your job is a low-paying job? All these are issues to think about. Some reflection questions. Should ability to pay ever determine access to care? So in certain countries, they have a dual system. For example, in NHS system, there is a government-run system as well as a private insurance system where if you can pay for private insurance, you can skip the queue because there are resources that is assigned for you because you can pay. These are some questions to think about. Can we ever design a system that is both fair and affordable? This is something very difficult because if you decrease the barrier to payment, people tend to use more. But is this a wrong thing? That's something to think about. At the same time, if fees keep going up, for example, emergency department, the fees can be quite high and a significant amount for those who are earning low income. Will this be a way to discourage them from seeking care? These are some of the things we need to think about. I have no answer for you. It really depends on your country, your healthcare system, and your personal beliefs. Some example for clinical practice. Choosing between expensive versus essential medication. WHO has a list of essential drugs. These drugs are generally subsidized, which means government thinks it's a good value of money. But what about new drugs or those drugs that treat rare diseases or cancer that has gone beyond the routine treatment? Is there a role for the government to pay at least for some of the payment? Or is it all or none? Either it's subsidized or it's not subsidized. Could the government, in essence, negotiate prices down so that medications can be affordable to the people who needs the medication? Deciding who gets intensive care unit beds during a surge. During COVID pandemic, this is a big problem. So many countries face issues on who can be admitted to an intensive care unit. Should this be based on ability to recover? If that's the case, this will actually bias those who are old with chronic diseases and those who are not likely to recover. But who needs the ICU more? Is it people who can recover or people who need it? So it's a question that we will decide on who gets the intensive care unit beds. Prioritizing preventive care versus acute care. In many countries, the focus is on acute care. Preventive care is something that is not seen. As a public health physician, a disease prevented is a disease avoided and not seen. So most of our work may not be so in the news, but this is something we think about. In the long-term management of chronic diseases, can we afford not to prioritize preventive care? Again, I have no answer for you. It's something that you need to think about and decide. Why economic thinking helps? Firstly, it clarifies the trade-offs and the resource allocation. There are two types of allocation. There's allocative efficiency, which means how do you best allocate resources, and there's technical efficiency, which means that if you decide to do certain things, what is the best way and more efficient way to do it. We want to promote transparency and fairness. Let's make the decision out. What are the criteria? Debate about it, not just make it a black box. We want to support evidence-based decision making. Everything we say, everything we do should be evidence-based. This may not always be possible, but as far as possible, evidence helps. Finally, health economics makes better decisions. This applies to us clinicians, managers, and policymakers. It helps you do the most good with limited resources, to not waste resources. There's a lot of waste in healthcare. Empower you to engage in system level improvement. I hope this has been useful. Thank you for listening.